So hello guys, our today's subject is dental anatomy. Let us discuss the MCQ on the subject anatomy. The first question is the angle of mandible in the parotid gland it is supplied by. Well, the angle of mandible in the parotid gland it is supplied by greater auricular nerve. So remember, the skin over the parotid gland and the angle of mandible it is supplied by the greater auricular nerve. So remember this. This one is the great auricular nerve. So this nerve it arises from the ventral rami of remember second and third cervical. So C2 and C3. So this great auricular nerve it arises from the ventral rami of the second and the third cervical nerves, and it is a branch. It is a branch of cervical plexus. So it will provide sensory innervation to skin over the parotid gland and the angle of mandible. So this region is this one is the parotid gland, and this great auricular nerve will supply the parotid gland as well as the angle of mandible. So the great auricular nerve it originates from the cervical plexus, from the ventral rami of the cervical spinal nerves, that is C2 and C3. So after its origin, the great auricular nerve it will run obliquely and outward across the sternocleidomastoid muscle, that is a large neck muscle. So it runs superficially along the muscle. As it ascends, the greater auricular nerve approaches and passes over the angle of mandible. So greater auricular nerve supply the angle of mandible. So it gives off branches in this region that will provide the sensory innervation to skin over the angle of mandible. Continuing its course, it reaches toward the external ear. So it sends branches to the posterior part of auricle and skin over the mastoid process of the temporal bone. The another branch of great auricular nerve extends toward the parotid gland, that is situated in the front and below the ear. So as its name is great auricular, reflects that its significant role in providing sensory innervation to the ear. So remember, for your exam point of view, this great auricular nerve will supply angle of mandible, external ear, and the parotid gland. The other option, ophthalmic, maxillary, and mandibular nerve. The mandibular nerve, it is one of the three divisions of the trigeminal nerve, and it supplies the sensory innervation to the lower jaw. The maxillary nerve, it's another division of trigeminal nerve. So the trigeminal nerve gives branches ophthalmic, maxillary, and the mandibular. So the maxillary division will supply the upper jaw and the surrounding areas, including the upper lip, cheeks, and part of nose. And the ophthalmic division, it provides sensation to the forehead, scalp, upper eyelid, and front of the scalp. Moving to the next question. The crista galli, it is a part of. Well, the crista galli, it is present on the ethmoid bone. So what is crista galli? So this region, this part of ethmoid bone is the crista galli. So it is a delicate, complex sponge-like bone that is located in the skull. So think of this as a bone spike sticking up from the cribriform plate. So similarly here on the skull, this part will represent the crista galli. Now what are the parts of ethmoid bone that you should know? The parts of ethmoid bone are the cribriform plate, crista galli, labyrinth, superior and middle nasal conchae along with the ethmoid sinus. The cribriform plate, this plate is like a thin wall that separates your brain area from your nose area. So the cribriform plate, it has tiny holes in it, and your sense of smell nerves go through these holes to help you smell things. Second is the crista galli. Think of this as a bony spicule that is sticking up from the cribriform plate. So it does not have a big job, but it helps to keep the brain's protective covering in its place. The other is the perpendicular plate. So this one area will represent the perpendicular plate. Imagine a flat, thin piece of bone that is hanging down like a curtains between your nostrils. So these parts helps to divide your nose into left and right side. Other are the labyrinth. The ethmoid bone looks like a bit like a sponge with lot of tiny pockets. So these pockets helps to make the air you breathe in your nose warm and clean. Other are the superior and middle nasal conchae. So this one is the superior nasal concha and middle nasal concha. So these are just like a shelf inside your nose that will make the air you breathe swirl around, which cleans and warms it before it goes deeper into your nose. The ethmoid sinuses, they are just small empty spaces inside the bone that are connected to your nose. So these are the parts that what makes your face feel stuffed up or congested when you have a cold. So the crista galli is a part of ethmoid bone. That's your answer. Coming to the next question, a patient following the peridectomy. It feels numbness on face that is present while shaving. It's due to the injury of great auricular nerve. We discussed earlier that the great auricular nerve, it originates from the ventral rami of second and third cervical rami, and it will provide sensory innervation to skin over the parotid gland, angle of mandible, and the external ear. So during peridectomy, what a dentist do, the most commonly incision that a oral surgeon will give is the modified Blair incision. So that starts in the front of ear, underneath the earlobe, and down into the cervical crease that is used to get access to the parotid gland. So we know that the great auricular nerve will provide sensation of skin over the parotid gland. So if during peridectomy, that is during this incision, if this nerve get injured, it can result in numbness in the area around the shaving site. That will corresponds to the sensory distribution of the greater auricular nerve. So option A is correct. Option B, well, is mandibular nerve. The mandibular nerve, as we know, it is one of the division of which nerve? It's the trigeminal nerve that supplies sensory innervation to lower jaw, that is the mandible, including lower lip and chin. The injury to mandibular nerve might cause numbness in the lower part of face, but it is less likely to affect the area typically involved in shaving, which are higher up on the face. Option C, facial nerve. Well, it's control the muscle of facial expression. During periodictomy, there is risk of injury to the facial nerve, but rather that would result in facial weakness or paralysis rather than the numbness. The other is the auriculotemporal nerve. It is the branch of mandibular nerve, division of that is trigeminal nerve. So it is very less likely to affect the areas involved in shaving. So your answer is greater auricular nerve. Moving to the next question. A 68-year-old woman, she is suffering from sudden bouts of pain over the area of her mid-face. Laboratory studies that she has a tic-Dolrex neuralgia. That is the involvement of the trigeminal, that is trigeminal neuralgia. So which ganglion is the location of neural cell body of the nerves mediating this pain? Well, your answer here is a Gazerian ganglion. So remember, the other name of Gazerian ganglion is the semilunar ganglion. So it is the location of the sensory neuron cell bodies of the trigeminal nerve. So first of all, you should know what is a Mcqs cave. Mcqs cave, it is a small hollow cavity inside your skull, specifically in area that is the middle cranial fossa. So this cave serve as a protective enclosure within the skull, and it is situated near the base of skull. The ganglion associated is the Gazerian ganglion or trigeminal ganglion or the semilunar ganglion. It is a bundle of clusters of nerves bodies that are located within this Mcqs cave. So it is an important part of trigeminal nerve, that is the fifth cranial nerve. So Mcqs cave is just like a small room inside your skull. Inside this room, you have Gazerian ganglion, that is the collection of the nerve cells. So this Gazerian ganglion, it is the part of trigeminal nerve. So that is responsible for feeling things on your face. So when you touch your face or feel pain in your face, the signals from these sensations travel through the trigeminal nerve, including the nerve cells in the Gazerian ganglion, then to your brain. So Mcqs cave, it is a space in your head where important bunch of nerve cells live, and they help you feel things on your face by sending messages to your brain through trigeminal nerves. So your answer here is Gazerian ganglion. Option A, geniculate ganglion. Well, it is associated with geniculate ganglion is associated with, remember, facial nerve. So it contains the cell bodies of sensory neurons for the taste sensation from the anterior 2/3 of tongue. So it will not be associated with the pain that is associated with the trigeminal neuralgia. Option B is Gazerian ganglion. Well, yes, it's the correct answer. Trigeminal neuralgia, it is a condition that is characterized by bouts of pain over the distribution of trigeminal nerve branches. So answer is B. The inferior glossopharyngeal ganglion, it's associated with the ninth nerve, that is the glossopharyngeal nerve. The otic ganglion, it's associated with the glossopharyngeal nerve. So your answer of choice is Caesarean ganglion. Moving to the next question, the Mcqs cave, it is related to the trigeminal ganglion. So answer is clear, already discussed. Answer is B. Which of following is the junction of frontal, parietal, temporal and greater wing of sphenoid bone? Well, the answer is pterion. So pterion, it is junction of 4 bones. Which 4 bones? This one is the frontal bone. This one is the parietal bone. This one is the sphenoid bone. And this one is the temporal bone. So 4 bones. Remember, frontal, parietal, temporal and sphenoid bone. It's the pterion. Option B. Now what is lambda? So all these images are taken from your standard textbooks through open Google source. This one is the lambda. So lambda, it is a point where the sagittal suture that separates the two parietal bone meets the lambdoid suture that separates the parietal bone from the occipital bone. The inion, it's also known as external occipital protuberance. The protrusion at the back of skull where the occipital bone will meet the neck, it's the inion. Vertex, it is the very topmost portion. The topmost portion of the crown of skull is the vertex. So answer here is pterion. This question is very important. Many times asked in your exam, answer is pterion. Next question, Turkish saddle is related to which point? So this one is a Turkish saddle. So it will resemble this structure, that is sella turcica. So sella turcica, it is a saddle-shaped depression that is present within the sphenoid bone. Which bone? Sphenoid bone. And it's the deepest part is known as hypophyseal fossa. So answer is hypophysis. So this fossa will house the pituitary gland, that is also known as hypophysis. Hypothalamus. So this one is the hypothalamus. It is the region of brain located just above the sella turcica. So this part plays an important role in regulating the physiological process like hormone secretion from the pituitary gland, and it is not actually located within the sella turcica. The uncus, it is a specific part of the temporal lobe of the brain located within the cerebral cortex, and this part is associated with functions like memory and emotions. Amygdala, it is a almond shaped cluster of nuclei located deep within the brain. So its function is emotional processing, memory and perception of emotional stimuli. Moving to next question. Superior ophthalmic vein, superior orbital fissure, it contains all except so answer is ophthalmic nerve. So option A is superior ophthalmic vein. So superior ophthalmic vein includes the superior orbital fissure, does include transmit the superior ophthalmic vein. So this vein is important venous structure in the orbit, and it drains blood from the superior aspect of eye and forehead. The inferior ophthalmic vein so this structure drains blood from the lower aspect of eye. Option C is ophthalmic nerve. The ophthalmic nerve itself does not pass through the superior orbital fissure. Instead, the superior orbital fissure allow passage of three branches of ophthalmic nerve, which are the lacrimal nerve, frontal nerve, and the trochlear nerve. So an easy mnemonic to remember it is LFT. So option C is correct. Nasociliary nerve. Nasociliary nerve, it is a branch of ophthalmic nerve that pass through the superior orbital fissure. It carries sensory fibers and provide innervation to the nasal cavity as well as the cornea of the eye. So your answer here is C. Moving to next question. All is true about the trochlear nerve, except. Well, the trochlear nerve, that is the which nerve? Cranial nerve 4. Trochlear nerve, it innervates the contralateral superior oblique muscle of eye. So this innervation is responsible for superior oblique action of depressing the eyeball and causes intorsion. Intorsion means inward rotation. Second option, it causes depression of eyeball in adducted position. So the trochlear nerve main function is caused to depress the eyeball when the eye is in adducted position. So that action would make the eye to look downward and inward. The trochlear nerve, it passes through superior orbital fissure, but it stays outside the annular tendon, also known as ring of Jin. So that option is also correct. In case of trochlear nerve, the lesion, the patient typically attains contralateral head tilt, not the ipsilateral head tilt. So this head tilt, it is a compensatory mechanism to elevate the double vision that occurs due to the paralysis of superior oblique muscle. So by tilting the head to the opposite side, the patient aligns the eye more vertically, reducing the severity of diplopia when looking down. So the answer is D. The joint that is involved in movement from movement of head from left to right, it's the answer is A, atlantoaxial joint. Well, the yes movement that involves the nodding of head up and down. So this movement, it is primarily controlled by which joint? Atlanto-occipital joint. That is located between the base of skull, that is the occipital bone, and the first cervical vertebra. That is, which one is the first? cervical vertebra, it's the atlas or C1. So that allows the head to move forward and backward movement, so creating the nodding motion. On other hand, the no movement, that is shaking the head to left and right, that is primarily controlled by atlantoaxial joint, that is located between the first cervical vertebra and second vertebra, that is the atlantoaxial joint. So that promotes the rotational movement of head, allowing you to turn your head from side to side. So your answer is atlantoaxial joint. Which of following is a separate bone? The answer is inferior nasal concha. Well, the superior nasal concha, it is not a separate bone, it is a part of the ethmoid bone. The middle nasal concha, it is also a part of ethmoid bone. So the middle nasal concha along with the superior nasal concha helps to increase the surface area within the nasal cavity to improve the air conditioning, whereas the inferior nasal concha, it is a separate bone. There are two inferior nasal concha, one on each side of the nasal cavity. The crista galli, it is not a separate bone, it is a bony projection that extends upward from the ethmoid bone within the skull. So mark your answer accordingly. The cranial nerve that is related to petrous, apex of petrous temporal bone, it's the cranial nerve 6. It's abduction nerve. Abduction nerve, it is related to apex of the petrous part of the temporal bone. The abduction nerve, it arises from the pontine medullary junction and exit the brainstem at the junction of pons and medulla. It then passes through the apex of petrous temporal bone before entering the cavernous sinus. So the lesion or compression at this point, it can lead to problem within eye movement, like the ability of eye to move outward, resulting in horizontal diplopia. So answer is D. Next question, the structures that will pass through the internal auditory meters, they are all except
चले अब
चलते हैं, बस 15 मिनट दे मेरे को, आ रहा हूँ. The first option is nerve of Rysberg. So nerve of Rysberg, it is a component of the facial nerve, also known as nervus intermedius. It carries sensory fibers and it is responsible for taste sensation from anterior 2/3 of the tongue. The anterior inferior cerebellar artery, it does not pass through the internal auditory meters. Well, remember, it is a branch of basilar artery, and it supplied blood to the anterior inferior part of the cerebellum. The superior vestibular nerve, is one of the two branches of the vestibulocochlear nerve that carries sensory innervation from semicircular canals in the inner ear. It passes through the internal auditory meatus. The cochlear nerve, it is other branch of vestibulocochlear nerve, and it passes through the internal auditory meatus. So answer is B. Mark your answer of choice. Incisive foramen transmit. Well, the incisive foramen, it will transmit greater palatine artery and the nasopalatine nerves. So the incisive foramen, this foramen, it is located behind the central incisors in the incisive fossa of the maxilla. So the nasopalatine nerve, that is responsible for providing sensory innervation to anterior part of the hard palate, including the mucous membrane, and along with the greater palatine artery. The structures that pass through tendinous ring of Zinn. The answer is C, nasociliary nerve. The nasociliary nerve, that is branch of ophthalmic nerve, it passes through the tendinous ring of Zinn. So this one is the tendinous ring of Zinn. The lacrimal nerve, it does not pass through this ring. The trochlear nerve also doesn't pass through this. The superior ophthalmic nerve, ophthalmic vein, does not pass. So your answer is nasociliary nerve. The thinnest bone is part of which bone? The thinnest bone is part of ethmoid bone. Ethmoid bone, it is the thinnest bone. It is delicate, spongy bone, and it is papery thin structure with the numerous perforation along with you see bony projections. Sutures that is present between the parietal and occipital bone. This question we have already discussed in the explanation part. It's the lambdoidal suture. So it is situated on the posterior aspect of skull and it connects. So this one is the parietal bone. It connects the two parietal bone with the occipital bone. So this area shown is the lambdoid suture. The sagittal suture. So this is the sagittal suture. It runs along the midline of skull and separates the two parietal bone. So sagittal sutures will separate these two parietal bones. The coronal suture. This one is the coronal suture. It runs horizontally. It separates the frontal bone, the two frontal bones from the two parietal bones. Metopic suture. So this one is the metopic suture. It runs in the midline of the frontal bone. So it is commonly seen in the infants, and it fuses as the person grows. The bone fuses at single frontal bone. Which of following attains adult size before the birth? The answer is ear ossicles. The ear ossicles consisting of malleus, incus, stapes, they are almost of adult size at birth. So remember that. So these bones play a role in the transmission of sound vibration to the inner ear. So these are well developed and functional shortly after birth. Next question. The palatine tonsil, it develops from which pharyngeal pouch? It develops from second pouch. So remember the table. The first pouch gives tympanic cavity, auditory tube. Remember all these structures. The inferior parathyroid gland comes from the third pharyngeal pouch from the dorsal part, and for the ventral part is the thymus gland. From the fourth pouch rises superior parathyroid gland, and for the fifth pouch is the ultimobranchial body. Sylvian point is related to which part of the temporal bone? It is related to the squamous part of the temporal bone. So the points correspond to the pterion, that is present point on the lateral aspect of the skull where the four bone meets. So this Sylvian point is important because it is located on the middle meningeal artery. So it is located over the underlying medial meningeal artery, and fracture in this area can lead to epidural hematomas. Modulus at the corner of mouth is formed by all of following muscles except. The answer is D, alachnavy. So modulus it is a point at the angle of mouth where the various muscles meet, like the buccinator, orbicularis oris, levator anguli oris, depressor anguli oris, zygomaticus major, risorius, platysma. So which muscle is not involved is the alachnavy. The facial artery does not supply the answer is the facial artery does not supply. The answer is external auditory meatus. The facial artery does not supply the external auditory meatus. The external auditory meatus it is supplied by the branches of external carotid artery, such as posterior auricular artery and superficial temporal artery. The lower part of nasal septum, the facial artery does supply the lower part of nasal septum through branches like the superior labial artery. A submandibular gland, the facial artery supply the submandibular gland, that is like the submental artery provides blood supply to the gland. The facial artery does supply the blood supply to the tonsils. So your answer is C. The first branch of inferior ophthalmic vein passes through which foramen? The answer is inferior orbital fissure. So inferior ophthalmic vein, it passes through this foramen. Which of following receives blood supply from the foramen lacerum? The answer is vein of pterygoid canal. So remember the foramen and structure passing. The posterior elevation and retraction of tongue, it is done by which muscles? So retraction and elevation of posterior 1/3 of tongue, it is done by styloglossus and palatoglossus. Depression done by hyoglossus, genioglossus on both sides. Retraction, it is done by styloglossus muscle and hyoglossus on both sides. Protrusion of the tongue, it is done by genioglossus on both sides acting together. So remember all these options. Moving to the next question, which of the following foramen it is located in the anterior cranial fossa? So your answer of choice answer is foramen cecum. So this one is the foramen cecum. It's located in the anterior cranial fossa. So remember the foramens that are located in cranial fossa, they are the foramen cecum, foramen of cribriform plate, and anterior ethmoid foramen. So think of your brain as a house, and anterior cranial fossa, it is the top floor. The top floor where your brain will sit. Now imagine there are small windows or opening in the floor of that top floor. So these openings are just like these are the foramens. So these foramens will allow the important things like the nerves and the blood vessel to pass from the brain into the face. So just a sort like how the windows they let in light and air into a room. So the foramen that is located in anterior cranial fossa, it's the foramen cecum. Moving to the another question, a patient who is not able to rotate his head. When he tries to rotate his head, the chin that will deviate to other side. So the muscle that is affected in this case it's the sternocleidomastoid muscle. The sternocleidomastoid muscle, it helps to turn your head in opposite direction. So if it is not working properly, your chin may point to the other side when you turn your head. So when you turn your head, the chin will move to the opposite side. So this condition, it is known as torticollis, or condition is known as wry neck. So imagine your sternocleidomastoid muscle. So imagine this muscle as a rope that goes from ear to your collarbone. So when this rope it is working properly, it helps you to turn your head easily, like looking both ways before crossing the street. But if this rope it get twisted or it does not work right, it will try to turn your head with a knot in the rope. So that is why your head won't turn smoothly and your chin might up pointing in a wrong direction. That is what we call it as torticollis or the wry neck. So if your left sternocleidomastoid it is shorter or tighter than the right one, it may cause head to tilt and rotate involuntarily to one side. So that make it difficult for person to hold their head in normal straight position. So that can lead to discomfort, pain and limited mobility of the neck. So when the sternocleidomastoid muscle it will not function properly due to condition like the torticollis, that can results in abnormal head position affecting the person ability to move their head and neck comfortably. So answer is sternocleidomastoid muscle here. Moving to the next question, which muscle play a role in winking? The answer is orbicularis oculi. So the orbicularis oculi, it is the key muscle that is responsible for winking. It has a palpebral part that closes the eyelid as in blinking or winking, and it has an orbital part that helps you to close your eyes tightly. The other muscles like the corrugator supercilii, so this one is the corrugator supercilii muscle, so that is responsible for drawing eyebrows together and wrinkling of the forehead, that is associated with the facial expression that is frowning. So main function of corrugator supercilii muscle is the frowning. That means when the muscle it contracts, It causes the inner end of eyebrow to move downward and medially. That gives a wrinkled appearance on the forehead. Other muscle like levator palpebrae. So this muscle is the levator palpebrae muscle. It is responsible for raising the upper eyelid. So it raises the eyelid, the upper eyelid. It helps to open the eye and keep it open. And it causes elevation of the upper eyelid. So when this muscle it contracts, it causes the upper eyelid to move upward, exposing the eye cornea and allowing for vision. This action it is essential for maintaining a clear line of sight. Other options like the muscles is levator labii superioris. So this muscle is the levator labii superioris. It helps to elevate the upper lip. So it helps to elevate the upper lip, and it is not primarily associated with winking. So mark your answer as B. Moving to the next question, the Stenson duct drains. Well, remember that the Stenson duct, it is the duct of parotid gland. Stenson duct is the duct of parotid gland. So, what is the function of this Stenson duct? It is responsible for draining the saliva from the parotid gland into the oral cavity. So, this one is the duct and this one is the parotid gland. So, where will this duct open? So, remember, very important question that can be asked by examiner in your entrance exam. Well, this duct it opens on the buccal mucosa opposite the second molar tooth. It opens on the buccal mucosa opposite the second molar teeth, and it will allow saliva to enter into the mouth. So, think you are enjoying a tasty piece of candy. So, your cheek, they have a special gland that makes your mouth watery by producing saliva. So, this saliva will help you to taste the candy better and make it easier to swallow. Stenson duct, it is a like small tube that starts in your cheek when the gland is where the gland is and goes into your mouth. So these small duct will carry the saliva from the cheek gland and release into your mouth. So Stenson duct make sure that your mouth stays wet and comfortable while you eat your candy. So that is why answer is parotid gland. Stenson duct drains the parotid gland. Remember that for your entrance examination point of view. Moving to the next question, which muscles will make up the pterygomandibular raphe? Pterygomandibular raphe, it is made up of tendinous fibers. So this raphe would give. So this raphe would give anterior attachment to fibers of the buccinator muscle. And posteriorly to fibers of superior constrictor, this muscle. So your answer is buccinator anteriorly and superior constrictor posteriorly. So imagine you are playing with a rubber band. So when you stretch it with your fingers, it become a tight connection. So pterygomandibular raphe, it is like just like a rubber band. like a tough band of tissues inside your mouth. So that will connect your cheek to your jawbone, like just like a natural support system that helps to keep everything in your mouth in a right place. Remember this raphe is attached above to the pterygoid humulus and below the posterior end of mylohyoid line of the mandible. So your answer here is C. Mark answer of choice as C. So pterygomandibular raphe, it is a fibrous structure that is located in oral cavity, and it serves as attachment point for superior constrictor muscle of the pharynx. That's the muscle that plays a role in swallowing, and it attaches to the pterygomandibular raphe posteriorly. The buccinator muscle, well, it is a thin flat muscle in the cheek that will play an important role like swallowing and speech. Moving to the next question, structure that are not passing through foramen ovalis. The structure this pic is from your Grays and from your BD Choracea. Structures that are not passing through foramen ovale, it's remember the mnemonic MALE, male. The structure passing are the mandibular nerve, accessory meningeal artery, L stands for lesser petrosal nerve, and E represents the missionary veins. So these are the structures that pass through these foramen ovale. Apart from that, you can see the structure that pass through the foramen spinosum. They are the middle meningeal artery, meningeal branch of mandibular nerve. So your answer here is the question is structure not passing through foramen ovale. Answer is B. It doesn't pass through the foramen ovale. Hope your answer is clear. The greater superficial petrosal nerve, it is a branch of facial nerve that carries parasympathetic fibers to the lacrimal gland, and it does not pass through the foramen ovale. Moving to the next question, which of following is not a part of ethmoid bone? The answer is inferior turbinate. Well, agar nazi, it is a small bony ridge located in the upper part of the nasal cavity. It's part of ethmoid bone and it contributes to the nasal septum. The crista galli, this one is the crista galli. It is a bony ridge within the ethmoid bone that projects upward into the cranial cavity. It will serve as attachment for falx cerebri that separates the two cerebral hemispheres. Inferior turbinate, well, it's a separate bone within the nasal cavity. So, answer is C. Uncinate process, it is a curved bony projection on the lateral wall of nasal cavity. It's also a part of ethmoid bone and it contributes to structure of the nasal passage. The bones that are small, irregular shaped and found along the suture lines, they are known as Fomian bones. So these are the small irregular bones that are found along the suture lines. Which muscle originates from greater and lesser cornu and body of Hoyt. So answer is hyoglossus muscle. So remember the origin. It originates from greater cornu and body of Hoyt bone, and it is inserted into the tongue. The action of this muscle is to depress the tongue. Genioglossus, its origin is from genial tubercle or the medial surface of mandible. Inserted into the hard bone and tongue. Action is it protrudes the tongue and depresses the parts. Styloglossus, origin is stylo process of temporal bone. Insertion into tongue. Action is it retracts the tongue. So remember this table, very important for your entrance exam point of view. What is the lower extent of the pharynx? Well, the answer is lower border of the cricoid cartilage. The cricoid cartilage, it is a ring-shaped cartilage located at the lower border of larynx, and it marks the lower extent of pharynx. So that is your correct answer. The posterior clinoid process is formed by dorsum sella. So this one is the dorsum sella, and this is the posterior clinoid process. So dorsum sella, it is the posterior portion of the sella turcica, that is a saddle-shaped depression in the sphenoid bone. The posterior clinoid process, well, it is the extension of the dorsum sella. So think of posterior clinoid process as a pair of little mountain peaks at back of your head, like tiny horns. Now remember the dorsum sella, it's having it's a ridge or a hill that connects these mountain peaks like a top of bridge. So when you picture the posterior clinoid and dorsum sella, it's like having two small peaks and connecting the ridge at the back of your head, just like a mini mountain range. So these structures, they are part of sphenoid bone in your skull, and they help to support your brain just like a natural helmet. Which one is a paired venous sinuses? So remember the paired venous sinuses, they are the cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparatile sinus, petrosquamous sinuses. So answer is all of them are paired sinuses. So the unpaired sinuses, they are the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus, basilar venous plexus, all are the unpaired sinuses. Moving to the next question, the sternal angle, it is used in locating accurately the trachea, it divides into right and left bronchi at the level of this sternal angle. So the sternal angle, it is located at the level of second rib. This second costal rib. The other name of sternal angle is the angle of Lewis. It is located at the level of second rib. So that is important for identifying, for counting the ribs and identifying the position of important structures in the chest. The nerve supply of the tip of nose. The tip of nose and lower part of dorsum of nose, they are supplied by external nasal branch of trigeminal nerve. So that provides the sensory innervation to this area of nose. The mandible fossa, it is a part of the glenoid fossa. It is a part of temporal bone. So it is a concave depressed area of the temporal bone. The mandibular condyle, it will rest in the glenoid fossa. A nervous dental student is performing local anesthesia for first time on one of his peers. He has read it notes meticulously and is very shaky. After inferior alveolar nerve injection, he gained confidence and performed the rest of injection without hitch. Next day, the classmate who performed the injection on is complaining of jaw pain and inability to open his mouth. So, which muscle did the nervous student penetrate during inferior alveolar injection? Along with the masseter forms a sling around the mandible. The answer is medial pterygoid. So, the muscle that the nervous dental student likely penetrated during the inferior alveolar nerve injection and that forms a sling around the mandible along with the masseter, it is indeed the medial pterygoid muscle. So this muscle, it plays a role in elevating the mandible during jaw closing. So the medial pterygoid muscle, we know that it arises from the medial surface of lateral pterygoid plate and it inserts on the medial surface of angle and ramus of mandible. The lymph nodes from the hard examination of a patient with ulcerative carcinoma of the posterior third of tongue revealed bleeding from lesion and difficult swelling. The bleeding was seen to be arterial. Which of following arteries was involved? Well, the answer is dorsal lingual artery. So the tongue, it is supplied by the dorsal lingual artery. The posterior third of the tongue, remember that. Which muscles causes retraction of the scapula? So remember the table, the answer here is rhomboides major. The muscle that causes elevation, depression, protraction, retraction. So remember all these muscles for your exam point of view. The esophagus crosses the diaphragm at level of vertebra. The answer is T10. So remember this. The trachea begins opposite to which vertebra? It's the C6 vertebra. So in this figure, you can see the angle of Lewis. Along with that, you can see the trachea and the main bronchi. So here the point that you have to note is the right main bronchus is shorter, wider and more vertical than the left. So this right main bronchus, it is shorter and this left main bronchus is taller. That is why the inhaled foreign bodies most commonly enter the right main bronchus. Easy to enter as it is shorter and wider. The lymphatics from the hard palate and soft palate, it drains to the retropharyngeal lymph node. So remember this. Here is the retropharyngeal lymph node. So it passes to the deep cervical lymph node to the retropharyngeal lymph nodes. So answer is C. Remember this table along with the lymph nodes from the submental area drain into the lower lip, chin, tip of tongue, anterior floor of mouth. And from the submandibular area, they drain into cheek, nose, upper lip, maxillary teeth, vestibular gingiva, anterior 2/3 of the tongue. And for the retropharyngeal lymph nodes, they drain into the nasal cavity, nasopharynx, soft palate, middle ear, external auditory meatus. So remember this for your exam point of view. The anterior superior part of the nasal septum, it is supplied by the anterior ethmoid artery. Additionally, the superior labial branch of facial artery contributes to blood supply in this region. The posterior inferior part, it is supplied by the sapheno-palatine artery. So answer is D, both A and B. This question we have discussed already. The movement at the following joint permits a patient to look towards right or left. It is atlantoaxial joint. The largest bone in the face is, it's the mandible. The fontanelle that is last to close is anterior fontanelle. Moving to the next question, which of following bones do not contribute to the nasal septum? Well, your answer here is, the answer is lacrimal bone. Well, remember, for your entrance exam point of view, the lacrimal bone, it is a small bone that is located in the orbit and it does not play a role in formation of nasal septum. The nasal septum, it is primarily formed by the perpendicular plate of the ethmoid bone and the bomber bone, with some contribution from the septal cartilage. So the other bones have sphenoid, palatine and ethmoid, they have some involvement in structure of nasal septum, while the lacrimal bone does not. So your answer is a lacrimal bone. The next question, the maxillary nerve, it leaves the middle cranial fossa by passing through. The answer is foramen rotundum. Well, for your exam point of view, just remember the foramens. The position of the foramen. Many a times in entrance exam you can get a question, identify this foramen, identify this foramen or identify this foramen. So remember the foramen location of the foramen lacerum. It is the foramen lacerum. It is located at the base of skull, and the maxillary nerves leaves the middle cranial fossa through this foramen. The foramen spinosum, well, it is located in the middle cranial fossa. As it exits the foramen spinosum, it is located in the middle cranial fossa and it is not related to maxillary nerve. It transmits the middle meningeal artery and the vein. The foramen rotundum, the maxillary nerve passes through the foramen rotundum as it exits the middle cranial fossa. So your answer is B. The foramen ovale, we have discussed that before in another MCQ. So your answer is foramen rotundum. The retromandibular vein, it is formed by union of two veins. That is, one is the maxillary vein. So this maxillary vein, and other is the superficial temporal vein. So these two veins form the retromandibular vein. So retromandibular vein, it is formed by union of these two veins. It continue to drain blood from the head and neck region, and it joins with the facial vein, the anterior facial vein, to form common facial vein that drains into the internal jugular vein. So your answer, retromandibular vein, it is formed by the it is formed by the union of maxillary vein and the superficial temporal. Which branch of external carotid artery originates at the hyoid bone? The answer is the lingual artery. The lingual artery, so this one is the lingual artery, as you can see here clearly in the pic, and this one is the hyoid bone. So this pic is from BD Choracea. Please follow these standard textbooks. The BD Choracea is must for your entrance examination. Many questions, they are direct pick from this book, BD Choracea, or the Gray's Anatomy. So the lingual artery, it originates from the external carotid artery just above the level of hyoid bone in the neck. So answer is A. Next question. The least vascular area in TMJ is at the central part of the articular disc. Well, we know that TMJ, it is a synovial joint that allows the movement of jaws. It consists of mandibular condyle. That condyle articulates with the mandibular fossa. That is a part of which bone? It is part of temporal bone. So in the TMJ, there is an articular disc that separates the two bones. So this articular disc, it is avascular in the central region. That means that it has very few blood vessels, or it is devoid of blood vessels. So this avascular zone in the central part of the articular disc is referred as avascular zone. So lack of blood vessels in the central area of articular disc is the one of the main reason why the healing capacity of TMJ is limited compared to other joints in the body. So the damage, if any occur in the central part, it may not heal, and it takes time due to its limited blood supply. So imagine your jaw as a door hinge that helps to open and close your mouth. Now this hinge is not simple hinge, it is just like more complex. Inside it there is something like cushions or cushion pad. So this pad, it is known as articular disc. So this disc sit between the two important part of your jaw, the upper part, the temporal bone, and the lower part is the mandible. So it is a soft layer that prevents these two parts from rubbing directly against each other when you move your jaw. So right in the middle of this cushion disc, there is special zone that is called as no blood zone. So this zone is a bit different as it does not have tiny blood vessels. It is like a desert with very few water sources. So when you use your jaw to eat, talk, or even yawn, so this cushion jaw will help you to everything to move TMJ very smoothly. But because the middle part does not have many blood vessels, it's not great at healing. So if there is any chances of injury, it's like having a weak spot in your armor. So mark answer D as your choice. True about the muscle of facial expression. So this image is directly from an open Google source. The statement A is not correct. The muscle of facial expression, they are derived from the mesoderm of first branchial arc. No, they are derived from mesoderm of second branchial arc. The second branchial arc give rise to structures primarily innervated by the facial nerve. Option B, they receive motor supply from the trigeminal nerve. The muscle of facial expression receive their motor supply from the facial nerve and not the trigeminal nerve. The trigeminal nerve primarily supply the muscle of mastication that are responsible for chewing. Option C moves the facial skeleton. The muscle of facial expression do not move the facial skeleton, that is the bone of skull. Instead, they move the soft tissue of face, such as skin and underlying structures. So these muscles, they are responsible for various expressions like smiling, frowning, raising the eyebrow. Option D have bilateral cortical representation in the region of forehead. So that option is correct. So this means that area of brain, it is responsible for controlling these muscles that are found on the both sides of cerebral cortex. Imagine you are looking in a mirror and you want to raise your this right eyebrow. When you decide to do this, the brain will send signals to muscle on the right side of your forehead to make your right eyebrow go up. So at the same time, the brain also sends signals to muscles on the left side of your forehead to keep everything balanced. So this is why you can independently raise either your right or left eyebrow and make different facial expression. So the bilateral cortical representation in your brain allows to have fine control over the muscle of facial expression, especially in the forehead region. Moving to next question, the first part of vertebral artery, it extends from origin to the answer here is a B. The first part of the vertebral artery, it originates from the subclavian artery and extends to the transfer process of 6th cervical vertebra. The middle layer of masseter, it arises from the anterior 2/3 of the deep surface and posterior 1/3 of the lower border of the zygomatic arch. So there are three layers: superficial, middle, and the deep layer. The superficial layer, it arises from the anterior 2/3 of lower border of zygomatic arch and adjoining zygomatic process of maxilla. Whereas the middle layer, it arises from anterior 2/3 of deep surface and posterior 1/3 of lower border of zygomatic arch. Whereas the deep layer arises from the deep surface of the zygomatic arch. And they are inserted, the fibers are inserted on the ramus and coronoid process of the mandible. The facial nerve, it exits from which foramen? Well, foramens are very important for your entrance exam point of view. Many of questions on the foramen, they have been asked. So the answer is stylomastoid foramen. So remember all these foramens: foramen magnum, hypoglossus canal, foramen spinosum, foramen ovale, jugular foramen, their location. Very, very important as per exam point of view. Next question, the parotid duct, it opens into vestibule of the mouth opposite to the crown of. This question we have already discussed in the previous MCQ. The answer is the opposite second molar tooth. The parotid duct, it is also known as Stenson duct, that opens into vestibule of mouth opposite which molar? Crown of upper second molars. Remember, opposite the crown of upper second molars. So that is your answer. The next question. The inferior sagittal sinus, it joins with greater cerebral vein. So the inferior sagittal sinus. So this one is the inferior sagittal sinus. It joins with the great cerebral vein. So this one is the great cerebral vein, and they together will form what sinus? This is straight sinus. So easy question directly asked from BD Chaurasia. Remember this diagram, very important for your exam point of view. Just go through all the diagrams mentioned in BD Chaurasia. The floor of the cavernous sinus, it is formed by the floor of cavernous sinus, it is formed by endo-ostial layer of dura mater. The roof, it is formed by meningeal layer of dura mater. The lateral border, it is formed by meningeal layer of dura mater. So the dura mater, the outermost and the toughest of the meningeal layer. So it has two layers. One is the endo-ostial layer and other is the meningeal layer. The endo-ostial is the outermost layer and it is attached to the inner surface of cranial bone. It contributes to the formation of floor of cavernous sinus. The meningeal layer, it is innermost layer of the dura mater and it is closely adherent to the brain. So the meningeal layer, it will form the lateral wall, root and the medial wall, while floor, it is formed by endo-ostial layer. Diaphragm cellae, it is formed. The diaphragm cellae, it is a dural fold that is formed by the endo-ostial layer of the dura mater. So it is a horizontal sheath of dura mater that covers the sella turcica, a bony structure in the base of skull that houses the pituitary glands. Which of following structures pass through the center of cavernous sinus? The answer is internal carotid artery and abducens nerve. So the internal carotid artery passes through the cavernous sinus. The abducens nerve, it also passes through the cavernous sinus. So both the internal carotid artery and the abducens nerve, it passes through the center of the cavernous sinus. The hyoid bone, it is at level of, well, remember these, the points. The body of hyoid, it corresponds to the C3 cervical vertebra. The thyroid gland, it is located below the hyoid bone between C4 and C5. The cricoid cartilage, it lies just below the thyroid cartilage at level of C6 cervical vertebra. So remember all these vertebrae. The answer is A. The sensory nerve supply to sternocleidomastoid is through the ventral ramus of C2 nerve. So that this nerve is responsible for proprioception that involves the sensing the position and movement of the muscle. The spinal accessory nerve, it primarily provides the motor innervation to sternocleidomastoid muscle. The skin of neck, it is supplied by cervical nerve C2, C3, C4. The front belly of occipitofrontalis, it is supplied by the temporal branch of the facial nerve. The occipital belly is derived from the lateral 2/3 of superior nuchal line and it is supplied by posterior auricular branch of the facial nerve. The front bellies, they are supplied by the temporal branch of the facial nerve, and the occipital bellies, they are supplied by the posterior auricular branch of the facial nerve. The superficial fascia in scalp, well, it is more dense, more fibrous and dense in the center. The superficial fascia in scalp, it is more fibrous and dense in the center than the periphery. So this center, it is known as cilia aponeurotica. It serves to bind the skin to the underlying structure, including the cranial aponeurosis. The second cervical vertebra is characterized by, well, the second cervical vertebra, it is also known as axis. It is characterized by presence of dens, that is also known as odontoid process. It is like a tooth-like projection from axis bone, and it acts as a pivot joint for rotation of the atlas. That is the first cervical vertebra and the head. So that helps to allow movement of the head from side to side. The posterior boundary of the jugular foramen, it is formed by, the answer is jugular process of the occipital bone. Which of following is not a suprahyoid muscle? The answer is omohyoid. Well, omohyoid, sternohyoid, sternothyroid and thyroid, they are the infrahyoid group. The omohyoid muscle, it is not a primary suprahyoid muscle. It is a part of infrahyoid group of muscle. The suprahyoid muscle include the digastric, mylohyoid, stylohyoid, which are located above the hyoid bone. Mesenteric nerve, it is branch of anterior division of the mandibular nerve. It innervates the masseter muscle and it helps in elevating the mandible to close the mouth and the process of clenching the teeth. So answer is C. So moving to the next question, the stylohyoid muscle, it is supplied by. So the stylohyoid muscle, it is supplied by a branch of the facial nerve. So this one is the stylohyoid muscle. So it has origin. The origin is at the styloid process. So it originates from the styloid process of the temporal bone. Think of styloid process like a tiny finger-shaped bone structure that hangs down from the base of your skull. Insertion, the muscle, it is inserted into the body of hyoid bone. So this one is the hyoid bone. It is inserted on the junction of the body and greater cornu of the hyoid bone. The stylohyoid muscle, it is supplied by a branch of the facial nerve. So the nerve is just like an electric wire that sends the signal from your brain to the muscle, telling it when to contract and when to relax. What is the muscle action of this stylohyoid muscle? So when the stylohyoid muscle, so this muscle would contract, it would produce following functions. It would produce elevation of this bone, that is hyoid bone. So imagine you are about to swallow a big bite of your favorite food. So your stylohyoid muscle, that would help to lift the hyoid bone upward. It is just like an elevator that carries the hyoid bone upward, that helps in the swallowing process. It helps in speech. When you speak, especially during certain sounds like Y, SH, the stylohyoid muscle, it plays a role in controlling the position of the hyoid bone. And it is important for articulating the sound. Similarly, as you enjoy a delicious sandwich, as you take the bite and start to swallow, your brain will send signal through the facial nerve, stylohyoid branch, to contract the stylohyoid muscle. So that will pull the hyoid bone upward, helping to move the food safely during helping to move the food safely down your throat. So that is how the stylohyoid muscle will act. So it is supplied by, well, your answer, it is supplied by the facial nerve. Let us move to the other options. The mylohyoid nerve, it is not a well recognized. The mylohyoid muscle, that is muscle of the floor of the mouth. It is innervated by mylohyoid branch of the inferior alveolar nerve, that is the branch of the mandibular nerve. The maxillary nerve, it is branch of the trigeminal nerve and provides sensory innervation to the upper jaw. The first cervical vertebra is not your answer. The answer is facial nerve. Moving to the next question. So let us discuss the suprahyoid muscles, their origin, insertion and nerve supply. That's very important for your entrance exam point of view. The digastric muscle, it has origin from the digastric fossa and it is inserted into the intermediate tendon of the digastric that is attached to the hyoid bone. Nerve supply is by mylohyoid nerve. The posterior belly, the origin is from mastoid notch and nerve supply is through facial nerve. The geniohyoid muscle, origin is internal mental spine of the symphysis, insertion again into the hyoid bone, and nerve supply is through C1 via the hypoglossal nerve. So remember the suprahyoid muscles. Which are suprahyoid muscles? Digastric, geniohyoid, stylohyoid, mylohyoid. Whereas the infrahyoid muscles, they are the sternohyoid, sternothyroid, thyrohyoid, omohyoid. So many a times the origin, insertion and nerve supply, that's the examiner favorite questions. So the infrahyoid muscles, they are supplied by ansa cervicalis. The sternohyoid muscle, origin is from posterior surface of manubrium sterni and insertion into the medial part of lower border of the hyoid bone. So remember the origin, insertion, nerve supply, that's very important for your exam point of view. Similarly, let us discuss the posterior belly of digastric. It has an origin from, just before we have discussed that, there are two bellies. One is the anterior belly of digastric and other is posterior belly of digastric. So just before we discussed that, the anterior belly origin is digastric fossa of mandible and the posterior belly origin is from mastoid notch. So let us see in the figure. The anterior belly is supplied by mylohyoid nerve and posterior belly is supplied by the facial nerve. So these are the two bellies. The anterior belly, it has an origin from digastric fossa of the mandible. So this attachment, it helps in depressing the mandible and opening the mouth. Whereas the posterior belly, it has origin from the mastoid notch of the temporal bone. Remember the posterior belly of digastric, it is innervated by a branch of which nerve? It's the facial nerve. The posterior belly, it has origin from mastoid notch. So imagine this at starting point on the bony ridge just behind your ear. And it is inserted into the intermediate tendon which is connected to the body of hyoid bone. Think of this tendon as a rope that attaches the muscle to the hyoid bone. The posterior belly of digastric, it is innervated by a branch of facial nerve. So when the posterior belly, it will contract, it helps to open the mouth by depressing the mandible. So it's like the muscle job when you want to take a big bite of your favorite sandwich. Whereas the anterior belly, it originates from the digastric fossa and it is inserted to the same intermediate tendon connected to the body of the hyoid bone. The nerve supply is remember the anterior belly of digastric, it is supplied by the mylohyoid nerve. So like you are having a delicious burger. When you take a bite, the anterior belly of digastric will help you to close the jaw by lifting your lower jaw. So when it's time to open your mouth wide to take another bite, the posterior belly comes into play, depressing your lower jaw. So together these two bellies of digastric muscles work like a team, allowing you to enjoy your meal by smoothly controlling the movement of your lower jaw. So with these two bellies that helps to open and close your mouth while eating and speaking. Moving to the next question, which of following muscles retract the protruded mandible? Well, it's the temporalis muscle. This temporalis muscle, remember, it is a powerful muscle. The posterior fibers of temporalis, they are responsible for retracting the protruded tongue. So they will help to pull the lower jaw back toward its resting position. So the temporal temporalis muscle, it originates from the temporal fossa, that is the concave region on side of your head, and it is inserted into the coronoid process. So it's the end point where the muscle will connect to the jawbone. So the temporalis, it is supplied primarily by the deep temporal nerves that are the branches of the trigeminal nerve. So what are the action of temporalis muscle? Then the first is the elevation of mandible. And other is retract the protruded mandible. So it helps in closing the jaw by elevating the mandible. And it also helps in retracting the mandible, that it helps to pull the jawbone backward. The anterior belly of digastric, it is supplied by, the anterior belly of digastric, it is supplied by mylohyoid, and the posterior belly, it is supplied by the facial nerve. The middle meningeal artery, it enters the cranium through foramen spinosum. So the foramen spinosum, it transmits the middle meningeal artery, meningeal branch of the mandibular nerve, that is the nervus spinosus, and posterior trunk of the middle meningeal vein. So let us talk about the pathway of this middle meningeal artery. So imagine the artery as a traveler on the road map. So in the beginning, it will goes upward and inward, passing deep under the muscle, that is the lateral pterygoid. And over the you can remember the lateral pterygoid as a bridge, and over there is a ligament, that is sphenomandibular ligament. Imagine it as a road sign. After that, it will enter the castle. So our traveler need to enter a castle, that is your skull, to continue the journey. So to do this, it goes through a special gate that is known as foramen spinosum. So think of this gate as a secret passage leading into the castle anterior. So once it enters the artery goes on an adventure within the castle walls, that is your skull. So it's important to know that there are other small roads nearby, but the artery stays a bit closer to the outer wall, and it divides into two separate branches, the anterior branch and the posterior branch. One is the frontal branch, that is the anterior branch, and the posterior branch is the parietal. So it crosses a point that is known as pterium. So this one here, it is pterium. So think of this as a crossroad. After that it moves upward and backward. Along with that, it comes close to an important area, that is the motor area of the brain that will control the movement. The other branch is the parietal branch. This one is the parietal branch. It goes backward, following a groove in the brain surface, and it ends in a front of specific part of the parietal bone, and it splits into the smaller rods. So understanding the middle meningeal artery path and its relation with important structures of brain is crucial for surgeons. So in case of emergency, they need to know where this artery is and how to handle it carefully in order to prevent bleeding around the brain that can be even life-threatening. So your answer, the middle meningeal artery, the answer is C. It enters into the cranium through the foramen spinosum, as we have discussed. Let us move to the next question. Which of following muscle is inserted into the pterygoid fovea? So this region is the pterygoid fovea. It's the lateral pterygoid. So the lateral pterygoid, let us discuss that. Imagine you are a builder constructing a bridge. That is your job. And that needs a strong cables. The cables are the muscles that are required to let your job work properly. Now there are two heads of this muscle, lateral pterygoid. One is the upper head, and this one is the upper head, and other is the lower head. So this one is your lower head. So a lateral pterygoid, it is a superhero with two heads. We have upper head and other is lower head. The upper head, it starts its journey from the top part of the grand castle, especially the which bone? Sphenoid bone. Whereas the lower head, it begins from side of tower within the castle. That is the lateral pterygoid plate. Now both these heads, they are on a mission. They run backward and bit to side like two cables joining forces heading toward the jaw. So these cables come together to form a strong attachment point that is known as pterygoid fovea on the front of your jaw. So the muscle insertion is in the pterygoid fovea. So think of this pterygoid fovea as a hook on the jawbone. So the lateral pterygoid muscle mission is to pull on this hook So when it contracts, it will help to open your jaw, move your jaw, and play a role in chewing. So just like a superhero that is receiving orders, the lateral pterygoid muscle get its instruction from special branch of the mandibular nerve. So when it contracts, it helps you to open and close your mouth. Allowing you to enjoy meals, speak, and express yourself. The sensory nerve supply of the parotid gland. Well, the sensory nerve supply of parotid gland is through auriculotemporal nerve. This nerve. Now the parasympathetic, the parotid gland, it receives nerve supply through parasympathetic nerves, sympathetic nerves, and sensory nerves. Now the parasympathetic nerves, they are the secret agents. So think of these nerves as a start button for your parotid gland for the parotid juice production. So when you eat, your brain will send signal to these nerves to tell the gland to release saliva. Whereas the sympathetic nerves, these are like traffic controllers. For the blood vessels around your parotid gland. They will regulate the blood flow to ensure that the parotid gland, it gets right amount of oxygen or the nutrients. It's like making sure the factory that is the parotid gland, it gets the proper resources. It needs to work properly. Whereas the sensory nerves, they are like watchdogs. They will keep an eye on the surrounding of your parotid gland. If something is unusual or potential harmful happens in that area, these nerves will send signal to your brain to alert you. That helps you to stay away from what's going around your gland and in your head and neck. So the parasympathetic nerves start saliva production. The sympathetic nerves will control the blood flow, and the sensory nerves will watch out for anything unusual. So the parasympathetic nerves, they are just like a secret agents. They start their journey from a special place, that is inferior salivatory nucleus. So they in their journey, they take a ride from the various nerves highways, like the glossopharyngeal nerve, tympanic plexus, and finally the lesser petrosal. As similar, you are changing trains. So once they reach the otic ganglion, this otic ganglion, they meet up with other agents for briefing. After briefing, the agent continue their mission by hitching and ride on this auriculotemporal nerve that acts like a secret agent car. So they finally reach to the parotid gland, where they tell it to start producing saliva. Moving to the next question, the platysma, it is supplied by. Well, the platysma, it is supplied by the cervical branch of the facial nerve. So platysma, remember, it is a thin sheet of tissue that wraps around your skin like a superhero cap. So it is supplied by think of the facial nerve as the commander of your face muscle. So when you want to show emotion on your face like surprise or stern look, the facial nerve will send signal to different muscles including the platysma. So the facial nerve tells the platysma to slightly tightens, making your neck look a bit tense. So that is its action. So which of following structure is absent on face? It's the deep fascia. Deep fascia, it is generally absent over the face. The ansa cervicalis supplies all of the following muscles except the term ansa cervicalis, it refers to a nerve loop or loop-like structure in the neck, in the cervical region. So it is formed, it has, the ansa cervicalis has two nerve branches. One is the superior root and other is the inferior root. The superior root, it is formed by ventral rami of C1 nerve, whereas the inferior root, it is formed by C2 and C3, second and third cervical nerves. So these two roots, they will unite to form ansa cervicalis, so which gives off branches to supply various muscles in the neck. So the ansa cervicalis primarily innervates the muscles such as infrahyoid muscles. They are sternohyoid, sternothyroid, and inferior belly of omohyoid. The geniohyoid muscle, it is supplied by the separate branch from the first cervical nerve through the hypoglossal nerve. So geniohyoid and thyrohyoid, they are supplied through hypoglossal nerve through C1. Absence of which of following muscle causes underdevelopment of mastoid process? Well, the absence of sternocleidomastoid muscle, it can lead to underdevelopment of the mastoid process. So your answer is A. The air sinuses which can be used as skeleton maturity index, they are the frontal sinus. So frontal sinus, it can be used as skeleton maturity index. Lymphatic from the lips drain into which of following structures? So answer is B. So remember the face has three lymphatic territories. This one, region A, B and region C. The region A is the upper territory that includes the greater part of forehead, lateral half of eyelid, conjunctiva, lateral part of cheek and parotid gland that drains into the preauricular nodes. The middle territory, this B region, it includes the central strip of forehead, external nose, upper lip, lateral part of the lower lip, medial half of the eyelid, that drains into the submandibular nodes. The third area is, this one is the lower territory. That is the central part of lower lip and chin, they drain into the submental notes. So this figure is very important for your entrance exam point of view, very well given in B teacher CA. The temporal, zygomatic, buccal, mandibular and cervical branch of facial nerve. So well, they are the terminal branches within the parotid gland. So temporal, zygomatic, buccal, maxillary, cervical, they are the terminal branches within the parotid gland. Maxillary sinus, it opens into the maxillary sinus. So the opening of the maxillary sinus, there is a region that is known as hiatus semilunaris. This region is hiatus semilunaris. In the middle meters, there is elevation, that is bulla ethmoid. So this one is bulla ethmoid, and below it there is hiatus semilunaris. And anterior to hiatus semilunaris is where the the frontal sinus open. The posterior to hiatus semilunaris, there is opening of maxillary sinus, and superior is opening is superior to this hiatus semilunaris, middle ethmoid sinus opening is there. So answer is posterior to the hiatus semilunaris in the middle meters. The sensory nerve supply of capsule of TMJ is by which of following nerve? It's by the auriculotemporal nerve. The mesenteric sling, it is composed of masseter, and the mesenteric sling, it is a powerful pair of muscle that wraps underneath the angle and the ramus of mandible. So on the lateral surface of mandible we find the masseter, and on medial surface we find the medial pterygoid. So the mesenteric sling, it will compose of masseter and medial pterygoid. The most common type of synostosis is that of the sagittal suture. So most common type of cranial suture fusion is the sagittal suture. The branch of the facial nerve that leaves the submandibular gland run forward anteriorly over the mylohyoid and branches into deep and superficial branches. It's the submental artery. The middle territory of face, it drains into the submandibular lymph node. Already discussed, this question we have already discussed. The foramen magnum transmits following structure through the wider posterior region. So through the wider posterior region, the structure passing are the lower part of medulla oblongata, and 3 meninges. So answer is, and from the narrow anterior part, the structures they are passing are the apical ligament of Dens, cruciate ligament, membrane tectoria. Through the subarachnoid space, the structure passing are the spinal accessory nerve, vertebral nerves, sympathetic plexus around the vertebral arteries. So the premature fusion of coronal suture along with the basal suture show which of following features? The answer is oxycephaly. So oxycephaly, it is also known as, remember, Pterycephaly. So where the multiple sutures in skull they fuse prematurely, that can lead to tower shape head. It involves the fusion of both the uh, sagittal and the coronal sutures. The trigonocephaly, it involves the premature fusion of the metopic suture. So that creates a triangular shape at the front of skull that gives a pointed appearance of forehead. The brachycephaly, it is due to the premature fusion of the coronal suture. So that fusion can lead into skull that is short from front to back, and that gives a flattened appearance at the back of head. The scaphocephaly means it is dolichocephaly. So that leads to narrow skull or boat-shaped skull. So where the sagittal suture that runs along the top of skull, it fuses prematurely. How many fontanelles they are present at birth? 6 fontanelles they are present. Anterior fontanelle, posterior fontanelle. There are 2 anterior lateral fontanelles and 2 posterior lateral fontanelles. A total of 6 fontanelles. The middle meningeal artery, it is associated with spinosum. Which of following structure passes through the inferior orbital fissure? It's the infraorbital nerve. Which of following ligament it is not a ligament of TMJ? The answer is pterygomandibular.